Hi everyone, welcome to our Africa PHE quarterly webinar. Before we start, I wanted to share a couple of quick logistical notes with you. So during the webinar, you'll be able to hear me and our presenters, but we will not be able to hear you. So if you have any questions or comments that you would like to share, please use the questions pane on your screen. We'll be using the second half of this webinar, about 30-35 minutes, to answer your questions. Also, there are a couple of handouts and resources from our guest speakers, which you can reference from the Handouts tab on your screen. So please go ahead and download those. And finally, we wanted to let everyone know that this webinar will be recorded and posted to the PRB and PACE project websites, and we'll also be sharing it through the Africa PHE newsletter. Now that that's out of the way, my name is Smita Gaith, and I'm a policy analyst with the PHE program at Population Reference Bureau in Washington, D.C. I'm joined today by my colleague Kristen Patterson, the PHE Program Director at PRB, and two guest speakers who I'll be introducing shortly, Jason Bremner of FP 2020 and Caitlin Thistle of USAID. Our topic today is leveraging high-impact practices for family planning and FP 2020 for population health and environment projects. This webinar is part of the PACE project, which stands for Policy, Advocacy, and Communication Enhanced for Population and Reproductive Health. Africa PHE quarterly webinars like this one are a way that the PACE project seeks to support the PHE community of practice and increase commitment for multi-sectoral approaches that integrate population health, environment, and other sectors. As a reminder, you can stay engaged with the Africa PHE community in a couple of ways. You can sign up for the Africa PHE monthly newsletter, which is mailed to the mailing list towards the end of each month. To sign up for that, you can email us at africaphe@prb.org. We also have the @AfricaPHE Twitter account. And finally, we host quarterly webinars like this one. So finally, I'd like to introduce our guest speakers. Jason Bremner is a Data and Performance Management Director at Family Planning 2020. He has more than 15 years of experience providing technical leadership on research translation, policy analysis, data for decision making, and capacity building. Previously, Jason was the Associate Vice President for International Programs, and he is the former Program Director for PHE at Population Reference Bureau. Caitlin Thistle is a technical advisor in the Research, Technology, and Utilization Division of the Office of Population and Reproductive Health at USAID. She supports the High Impact Practices in Family Planning Initiative and the Passages Project, which aims to develop evidence and promote application of effective, scalable interventions that transform social norms related to sexual and reproductive health among youth. And finally, Kristen Patterson is the Program Director of Population Health and Environment at PRB. In addition to serving as a Peace Corps volunteer in rural Niger for 2 years and working for a few years in Madagascar as a Population Environment Fellow, she has also spent 20 years working at the nexus of community development, public health, and environmental conservation. Before joining PRB, Kristen worked at the Nature Conservancy for 6 years, during which time she helped launch a PHE project in Western Tanzania, which continues today. Many of you tuning in today might be new to the population health and environment approach, so just a quick primer. PHE programs integrate approaches that improve access to health services, especially family planning and reproductive health, while helping communities manage natural resources and conserve biodiversity and the critical ecosystems on which they depend. PHE programs can be customized to fit the needs of communities in which they're implemented, but at their most basic level, they typically address family planning and reproductive health needs, as well as other primary health needs, and this enables communities to also prioritize conservation, natural resource management, and related issues like sustainable livelihoods and food security. Human health, population dynamics, and the environment interact in many ways. For example, people depend on their local environment and natural resources for food, timber, flood protection, livelihoods, and recreation. Rapid population growth, which in many cases is driven by an unmet need for family planning, can drive unsustainable environmental practices which impact health and economic outcomes and places pressure on social sector services like education and healthcare. PHE projects recognize these links and address family planning, reproductive health, and primary health needs so that people can also care about the environment and conservation of natural resources. So why integrate population health and the environment? PHE is an excellent way to help remote communities develop. Integrated projects are cost-effective and time-efficient for communities. They often lead to improved participation of men in reproductive health and family planning and of women in natural resource management. Family planning and conservation are often better received when they're packaged together with other benefits like small income generation. Integrated projects can reach the most hard-to-reach populations, also known as the last mile, and they can be more responsive to the community's self-identified priority needs. So with that, I would like to turn it over to Jason Bremner, who will talk about FP 2020 and how the PHE community of practice can align itself with FP 2020.
Thanks, Smita, for the introduction. Welcome to all of you on the line, and thanks, Smita and Kristen, for the opportunity to join you this morning and the invitation to talk about Family Planning 2020 and the potential connections with the population health and environment community. I'll say PHE from here on out. It's a real pleasure to be back here at PRB, and I want to set the stage for why we're having the webinar today, why we thought it was a good idea to connect better with PHE projects. In 2013, when we had the pleasure to organize an together that I believe PHE projects can use to leverage both greater visibility, relevance, impact, and scale up. So over the next few minutes, I'll walk through several aspects of FP 2020 that I think could be important for PHE projects to better understand. FP 2020 is an outcome of the 2012 London Summit on Family Planning. And it's based on the principle that all women, no matter where they live, should have access to life-saving contraceptives. Family Planning 2020 is a global movement, and it supports the rights of women and girls to decide freely and for themselves whether, when, and how many children they want to have. At the 2012 London Summit on Family Planning, more than 20 governments, both developing country governments and donor governments, made commitments to address the policy, financing, delivery, and sociocultural barriers to women accessing and using contraceptives, and also getting the right information and supplies that they needed. Since then, since 2012, 4 years later, the number of countries that have made FP 2020 commitments among the developing countries, and there are 69 developing countries that are targeted through FP 2020. 38 of those have made specific commitments to accelerate progress on family planning. And there are more than 90 total commitments from donors, civil society organizations, and the private sector in support of an FP 2020 goal. And in 2015 alone, donors had provided $1.4 billion in bilateral funding for family planning, and that's 30% more than in 2012 when the initiative started. So this is this palpable feeling, it's the commitments, it's the increased financing, but there's a lot more to it, and I want to get into more of how Family Planning 2020 has grown as a platform. Family Planning 2020 is not just the secretariat where I am currently working. Family Planning 2020 is really a network. It's a network of donors, of family planning leaders who are coming together in what we call at the center of that figure, a Family Planning 2020 reference group. And these leaders are helping to coordinate decisions, financing, momentum, and support for family planning from high levels of leadership in country governments and in donor governments and civil society. So beyond the leadership, FP 2020 brings together a full range of stakeholders and experts as well at country level and at a global level. And some of the critical functions that I think are important for people to understand, or the PHE community to understand, are on the right-hand side there, the country and donor focal points. So in each country, there are focal points that bring together USAID, UNFPA as two critical partners, the country government, as well as often DFID and Gates Foundation if they're present in those countries. In addition, there are key civil society contacts that are regularly connected with focal points. In addition to that, where I work on the lower left-hand side is on the data and measurement side of things, and you'll see the Performance Monitoring and Evidence Working Group, and I'll talk a little bit more about that in the future. But altogether, there are many opportunities for increased collaboration that did not exist in 2012, and this is where the PHE community can really start to connect with the FP 2020 network. And all of this is in service of a large goal, which is to accelerate progress by 2020 and enable 120 million more women and girls to use contraceptives. Last year marked the midpoint of the FP 2020 initiative, and our annual report marked substantial progress, yet still a large gap in terms of our efforts towards 120 million additional users of family planning. On the progress side, there are now more than 300 million women and girls in the world's 69 poorest countries using modern contraception, and this is an extraordinary milestone. It's a testament to decades of dedicated work by the entire family planning community, but it's also a testament to the acceleration that we have embarked on over the last several years. More than 30 million women of those users have been added just since the London Summit in July 2012. We have a long way to go, and the gap between 30 million additional users and 120 million additional users is large. And we can only succeed in delivering results by supporting and magnifying the efforts of the global community and country-level partners. And that means, for us at the Secretariat, focusing on 4 critical cross-cutting initiatives. First is driving country support, promoting data use and performance management. Second, sharpening the focus on global advocacy, rights, and youth, and the dissemination of knowledge and evidence. And I'll just touch briefly on each of these and where you can find additional information and critical pieces of this. At a country level, a lot of the work of FP 2020 is focused on costed implementation plans, or you may have heard of CIPs. The costed implementation plan is a multi-year actionable roadmap that's designed by governments and with the family planning stakeholders to help achieve family planning goals. And that's not the large global goal of 120 million additional users. It's a country goal that's set by that country, and those goals can be ambitious, and they can be towards accelerating family planning use, but they can also be in support of improved services, rights-based family planning, better outreach, and an effort towards more equity across family planning use, and more sustainable financing. Cost implementation plans are short-term, so they tend to be 3 to 5 years, and they are regularly being renewed and revised. And they're a critical tool in setting forth what a country will prioritize. Very few of these costed implementation plans actually incorporate population health environment projects as a strategy towards reaching those hardest to reach populations and expanding access to family planning. And I think there's an opportunity to better understand the CIPs and to ensure that population health and environment has a place in this. Another aspect of FP 2020's country support work is a rapid response mechanism grant system that responds to emerging unanticipated or time-bound opportunities that will help FP 2020 accelerate progress. The rapid response mechanism supports generally small efforts, time-bound. They tend to be 3 to 6 months, and we try to turn around these catalytic grants that unblock challenges to stimulate FP 2020 work in short order. Rapid response mechanism information is available on our website, and it is one of the resource materials that that Smita mentioned at the outset are available for download. I work closely on our data and measurement aspects of FP 2020, and as a time-bound initiative with a goal, an ambitious goal for 2020, we're really placing a great emphasis on measuring progress. Through our digital progress report and the measurement, which is done at a country level. And I encourage all PHE partners to understand where programs are, where countries are in terms of progress on family planning. We produce annual estimates of contraceptive prevalence rates, unmet need, demand satisfied, as well as many other measures of quality, stockouts, and method mix on contraception. And I think it's important as you start to coordinate with Family Planning 2020 partners that you look at the measurement aspects and where your countries are, but also that you connect with the partners who are annually producing those estimates. And those are generally done through consensus workshops each year in which family planning stakeholders come together, review the data, and make decisions in light of the costed implementation plan about the coming year's priorities. One place where I think there's really great overlap between the efforts of FP 2020 and the PHE community is our efforts to closely align on the Sustainable Development Goals. Achieving the FP 2020 goal is a critical milestone on our way towards the 2030 Sustainable Development Goals 3 and 5, which call for universal access to sexual and reproductive health rights and gender equality, as well as meeting demand for family planning. But we all agree, I think, amongst our community that family planning is vital to the other 15 goals as well. I think the PHE programs are a great connection between family planning and so many other of the SDGs, and there's a great opportunity to connect through our global advocacy and country-level advocacy efforts to ensure that family planning isn't left out as a priority for reaching the SDGs and that it's integrated with other efforts. And finally, and my colleague Caitlin Thistle will talk at more length about our efforts on knowledge dissemination and evidence, FP 2020 is serving as a platform to disseminate best practices and high-impact practices for family planning. And we do this through both our website and social media channels, as well as through efforts with partners like USAID, like IBP implementing best practices to get information out to those who are making program and financial decisions for family planning. Oh, one more slide. I think one of the critical ones that we have focused on more recently is the high impact practices for family planning, which predate FP 2020 and are a great opportunity for the PHE community to better understand and to better become involved with. And with that, I will turn it over to Caitlin, and we'll answer questions at the end of our presentation. Thanks.
All right, thanks, Jason. Hi, everyone. My name is Caitlin Thistle, and I am a USAID Global Health Fellow with the Public Health Institute. As Jason said, we know that family planning interventions are central to PHE programs. So today, I'm going to share a resource with you to support your strategic decision-making in family planning programming. First, why were HIPs created, and what problem might they help solve for you? We know that there are many ways to increase knowledge and use of contraception, and decision makers like yourselves don't have the time to review decades of learning in order to identify what works in family planning. HIPs were created to address this gap and develop consensus around high-impact practices in family planning. So first, HIPs are a set of evidence-based family planning practices. For each practice, all of the current evidence, including unpublished gray literature, is reviewed to determine whether the practice is a HIP and how widely it can be recommended. These practices are vetted by experts against specific criteria. And what are those criteria? First and foremost, each HIP has demonstrated impact on contraceptive use and is relevant in a variety of country contexts. Consideration is also given to replicability, scalability, sustainability, and cost effectiveness. Finally, these practices and the current evidence base of impact are documented in an easy-to-use format, and I'll introduce the HIP briefs in a few minutes. So who are these experts who decide what is and what is not a HIP? These are the members of the HIP Technical Advisory Group, or TAG. The TAG is made up of more than 25 international experts in family planning research, programming, and implementation, identified from donor agencies, research institutions, and service delivery organizations. The TAG generated the HIP criteria and meets at least once a year to review new evidence and make recommendations. You can find the biographies of the TAG members and the reports from each TAG meeting on our website. Our website URL is on the HIP list, which is in the resource section, which can be downloaded by you. HIPs are endorsed by over 25 organizations. These endorsing organizations play a vital role in developing, reviewing, disseminating, and implementing high-impact practices. Many of these organizations also implement PHE programs. You can see the organizations along the bottom are etched in a box. These organizations make up the HIP Secretariat, and members of the HIP Secretariat set the agendas of yearly TAG and endorsing organization meetings. They select new members for the HIP TAG, and they support promotion and outreach of HIPs. As Jason mentioned before, FP 2020, make sure that the HIPs are on their website. They help disseminate them on Twitter, and all of these partners at the bottom are key players in promotion of high-impact practices. And here are the current set of HIP briefs. Approximately 2 have been developed each year since the HIPs were created in 2012. These 8-page briefs have been written by various authors who are identified as experts in each area. Each brief defines the practice, identifies challenges each practice can address, summarizes the evidence of impact, and offers implementation tips. So you'll see here that briefs are organized by type and level of evidence. There are 4 types of HIPs. There's enabling environment, service delivery, social and behavior change, and HIP enhancements. You'll see on the left side that these are our enabling environment briefs. They're coded in this pink kind of salmon color. Some examples of these, as you can see, are supply chain management, policy, and galvanizing commitment. The service delivery HIPs are coded in blue and include different levels of evidence. You can see the dark blue briefs at the top. These are proven practices. These are practices that are supported by sufficient evidence to recommend widespread implementation. Some of these are community health workers and mobile outreach services. Then you'll see there's kind of a light blue color, and we have two briefs that are promising practices. This means that good evidence exists that these interventions can lead to impact, but more information is needed to fully document implementation experience and impact. Finally, within service delivery, we have an emerging HIP designated with a white panel. So this has a strong theoretical basis, but there's limited evidence to assess impact. Therefore, when implementing emerging HIPs, they should be implemented within the context of research or an impact evaluation. You'll also see our newest HIP category, social and behavior change. We have one so far, which is community group engagement, which I'll talk about a little bit later. And then our final category is our HIP enhancements. So there's 2 points I want to make before I move on from here. I want to say that these practices are not new. Many of these practices have been implemented for decades. Rely on our partners like you to inform the evidence base and share implementation experience. So now I will dive into 3 specific high-impact practices which are commonly found across PHE programs. These practices may not be identified as HIPs in the field, but you likely know of a HIP being implemented right now, and you just might not have known that it is identified as a HIP already. So community health workers, this proven service delivery practice is to integrate trained, equipped, and supported community health workers into the health system. In Madagascar, individuals who had direct communication with community health workers were 10 times more likely to use modern contraception than individuals who did not. This is one example of some impact evidence that we have that community health workers makes a difference to contraceptive use. Many PHE programs use community health workers to advance family planning, but might not identify them as community health workers. Just one example is Blue Ventures program called Safidi, meaning the freedom to choose. Blue Ventures trains and supports local women in southwest Madagascar to offer community-based family planning and other health services, integrated closely with Madagascar's Ministry of Health system. These CHWs offer family planning counseling and contraception, including condoms, contraceptive pills, and hormonal injections. Blue Ventures is piloting the use of smartphones to monitor and assure the quality of these services. This use of smartphones is a HIP enhancement called mHealth. By framing these interventions as high-impact practices, implementers can use the HIP briefs to sharpen implementation. They can document their implementation experience and build the evidence base, and more clearly communicate their program. An example of an enabling environment HIP used often with PHE programs is Galvanizing Commitment to support family planning programs. Some evidence of impact we have within this HIP comes from Senegal. Senegal's President Abdoulaye Wade stated his commitment to family planning at the 2011 International Conference on Family Planning in Dakar and renewed his commitment at the 2012 London Summit on Family Planning. As a result of his expressed commitment, the MOH is employing more staff to provide family planning services, expanding the method mix to better meet clients' needs, and fostering an environment to expand the role of the private sector. Since 2012, Senegal has experienced a rapid increase in modern contraceptive use, from 10% in 2010 to 2011 to 20% in 2014. The PHE Ethiopia Consortium, move forward. Yep. Or PHE-EC is an example of a PHE organization which galvanizes commitment in order to support family planning programs. PHE-EC brings together population, health, gender, and environmental organizations to advocate for mainstreaming reproductive health and family planning in the activity plans of non-health sector government ministries. PHE-EC also advocates donors to allocate FPRH funds towards integrated projects. Finally, the community group engagement is our newest HIP and is defined as engaging and mobilizing communities in group dialogue and action to promote healthy sexual relationships. Some impact data we have for this HIP comes from Kenya. In Kenya, 150 trained community-based facilitators held ongoing community dialogues with men and women about gender, sexuality, and family planning over 3.5 years. Women who participated in these dialogues were nearly 80% more likely to be using modern contraceptives at end-line compared with women who did not participate in these dialogues. One example of a well-known PHE program which utilizes community group engagement is the HOPE LVB, or Health of People and Environment Lake Victoria Basin Project. This multi-component program works at the individual, community, and structural level. At the community level, the HOPE LVB project builds the capacity of pre-existing community groups to mobilize communities to adopt healthy behaviors and engage in sustainable practices. So with that quick overview, I encourage you to review the HIPs and discover which ones you are currently implementing or which ones you could add to your programs. The HIPs can be used for strategy development. You can review the barriers to contraceptive use in your community and then review the barriers each HIP can help you overcome in order to determine the most appropriate HIP for your context. HIPs can also be used for program design. The HIPs, or the briefs, give you the key elements of each practice and can guide your beginning thoughts of what a program should look like. HIPs can also be used for advocacy. Maybe you're implementing a HIP and you're getting some pushback from an important stakeholder. You can use the briefs to show decision makers the evidence of impact. And then finally, the HIPs can support your implementation. Many HIPs could be implemented in a more effective or sharpened way. We see this a lot where somebody is implementing a high impact practice in the field, but maybe could be doing it in a little bit better, more effective way. So the briefs provide implementation tips which can be used to sharpen the effectiveness of your implementation. For any and all information about the HIPs, please visit sphighimpactpractices.org. No reason for you to scribble that down really quickly. Our website URL is on the HIP list, which again you can download in the resource section on the right of your screen. So thanks for your attention. I look forward to answering any questions that you have along with Jason and Smita and Kristen.
Thanks, Caitlin. So as Caitlin mentioned, there are a couple of resources which we would encourage you to download. We have about 20 minutes left, so I wanted to encourage everybody to submit your questions. You can use the questions pane in the webinar panel. So we'll wait for questions to come through. It looks like so there are a couple of questions about HIPs. So Caitlin, somebody has asked, why isn't PHE considered a high impact practice?
That is a great question. You know, as I said, the HIPs are only, currently what we have. It's always expanding the current set of evidence-based practices. So that's not to say that PHE couldn't be a HIP. I think there's some work to do to define the practice and to look across the evidence base to see what evidence we have of impact for that specific practice. A more appropriate HIP might also be integrating family planning with the non-health sector in general, of which PHE contributes.
So thanks, Caitlin. I see a question here that asks, to what extent are environmental organizations currently involved in any of the FP 2020 working groups or civil society engagement? And that's from Tricia Petruni. Hi, Tricia. Good to hear from you, and thanks for your question. That's a great question that we've been working on just actually over the last several months. First, to say that let's broaden it from environmental organizations to organizations that are actively involved in population health and environment. In terms of those that are actively involved in population health and environment, we actually received a few new commitments just this fall from organizations that are very involved in population health and environment. And so that was exciting. You can look at our commitments page on the FP 2020's website to see some of those. They include that I'll take from there, which is if they aren't really involved, are we willing to more deliberately draw them in? I think that's something that we actively are trying to do. We had a recent small lunch gathering to talk to folks about how we might do that and where we overlap, and we look forward in the coming year to identifying some clear actions where we might connect better. So thanks. And I think our advocacy around the SDGs is one in which we're particularly well connected, and I know you've been a big part of that. I'll turn it to Caitlin to take the next question.
So I see a question. It reads, what channels do you recommend for disseminating our research related to HIPs? This is a great question. Thank you for asking it. One thing that I will say is that if you have evidence, if you have documentation of impact of one of these high impact practices, I encourage you to go to our website, and at the bottom there is a contact us link, and you can just start the conversation with us and say, hey, I have something for you that I think might be helpful for one of your briefs. I think getting evidence into the high impact practice briefs is one of the best ways to build the evidence base and disseminate your evidence. So thanks for that question.
And I think that also covered a question from Joseph Fish with a similar question about how to share field gathered evidence with the tech advisory group. So thanks, Caitlin, for covering both of those. I'm going to take this question on the role of young people and how best they can be actively engaged in the FP 2020 platform through research planning, implementation, and thanks for that great question. This is something that FP 2020 in 2016 really prioritized. And there are a couple ways. I'm not the youth engagement manager, but a couple of ways in which we actively have made steps towards doing that. One of the critical ones was to actually invite a young person to be part of the FP 2020 reference group. So there is now a representative or woman named Margaret Balaji, who is active in the youth SRHR community, who is part of the FP 2020 leadership group. They are actively making decisions and constantly talking about how to better meet the needs of youth and how to better engage with youth. In addition to that, FP 2020 at a secretariat level hired a youth engagement manager named Emily Sullivan. Her contact information is available through the FP 2020 website, and she is connecting with country youth networks to better engage them in all sorts of platforms, including at a country level when we're having meetings. We generally have youth engagement meetings both in tandem and as part of our meetings, and I encourage you to reach out to Emily to get involved in various country level and global efforts.
Great. So I see a couple of questions. I see a couple of questions about the criteria again for what is a HIP and why PHE might not be a HIP yet. Just to reiterate, first and foremost, the top two criteria for a high impact practice are demonstrated impact on contraceptive use and relevancy in a variety of country contexts. So consideration is also given to four things: scalability, sustainability, cost effectiveness, and replicability. So yes, I think there is a lot of evidence that PHE is effective in getting impact in family planning outcomes, desired family planning outcomes. And again, I think it's just we need to bring together some authors and define the practice and look at the evidence. And somebody asked, you know, what's the benchmark that you use for this evidence? I will very honestly and clearly say that this is certainly an art and not a science. We look at the evidence base, and the authors kind of take their best stab at it, and the technical advisory group, you know, makes their best judgment based on the evidence.
Thanks, Caitlin. I see one question on measurement that I'm going to answer, and then a broader question. So just first on measurement, someone asked, did I get the information that 120 million women and girls are expected to use contraception by 2020, and we've already exceeded that with that 300 million women and girls number. Now, sorry I wasn't clear on that, or if I wasn't clear, let me clarify that what we aim for is 120 million additional women as compared to 2012 using family planning by 2020. We estimate that in 2012, there were approximately 270 million women using family planning in the 69 poorest countries. There are now 300 million women using family planning just 4 years later. That was as of the midpoint of 2016. So the number we're aspiring to achieve is actually 390 million women. So we do have a long way to go to get there, and it's going to take the whole family planning community working together to accelerate progress. But the broader question that I had, and I'll link to this, is, you know, how does PHE best contribute to those efforts? I think, you know, I would advocate that population health environment projects position themselves as not accelerating progress, but making sure that no one is left behind. I think in the effort to accelerate progress, you have to make decisions, and you could make decisions to focus your efforts on those who are easiest to reach. You could focus all of your efforts on urban places, and try to reach more women that way. FP 2020 does not aspire to do that. It is not at the expense of equity. And FP 2020 as a platform, all of the partners aspire to ensure that no one is left behind. And we do actively measure family planning progress amongst the lowest quintile every year. And you'll find that information for each country in the progress report tables. PHE communities, as Smita mentioned, really aim to reach that last mile. Many of those who have traditionally been beyond health care systems and might be beyond the reach of some of the FP 2020 efforts in the costed implementation plans. And there is where I think the PHE community can make the case that in their effort to accelerate progress, the PHE programs are trying to reach those who may be left behind and are sort of balancing the equity. And I hope that you'll all, in your efforts at a country level, and as you're talking to the FP 2020 stakeholders in the family planning community, that you'll talk about PHE in that way. I think that's important.
So I see a question about whether you can easily download all of the HIP briefs in one click. And the answer is yes. If you go to our website,
So another question that's come in is how can the PHE community or PHE projects better connect with FP 2020 country level activities and what's happening in countries? I mentioned a few of the structures earlier, focal points being a key one, but focal points are sometimes hard to reach. There are people who are at high level positions in government and donor agencies. But they are just a way in which the Secretariat and other partners are communicating with countries, but more broadly, most FP 2020 countries have technical working groups. Many of them predated our FP 2020 efforts, but they are coming together at least annually, but often quarterly, to assess progress towards their costed implementation plans, but also towards shorter-term action plans or action priorities that that the focal points and family planning community have agreed upon. So this shorter list of priorities is often reviewed, and as well as quantitative new survey information that comes in or service statistics information. That's often done through a consultative workshop, and those usually include the technical working groups. I know that some of the family planning partners who are actively involved in PHE projects are already participating in these, but I suspect that some of the partners who are in the field more may not be aware of these meetings. I encourage you to reach out to us, and we can try to connect you with the country level consensus workshop meetings that are happening semi-annually and sometimes more frequently.
So we have another question that I wonder if Jason can answer from Nana Dagadu. She said, could you please send the names of the orgs, communities of practice, etc., that Jason mentioned in the follow-up slides or notes?
Sure. So we have, again, most of the information is available through the FP 2020 website, in which you can find the names of organizations that are part of the reference group. The reference group individuals and organizations are clearly noted there. Some of the resources that I provided in the downloadable links can refer you to the website if you're not sure where to find the website. In addition, the members of our measurement or PME working group, Performance and Measurement Evidence Working Group, the individuals and the organizations they represent are listed there as well. And in addition, we have an expert advisory community that is now active and is larger and includes, again, many more organizations. That is also an opportunity to connect. The reference group and the PME working group are closed, sort of invite-only small groups. The expert advisory community is a larger group, 100 plus people who are consulted through webinars.
So we have one more question that I'm also going to ask Jason to take. It says, for organizations that have strong FP-SRH programming, what would you suggest as one of the first steps to integrate strong PHE approaches?
Great question. I think there are one of the best ways that we've found for organizations that are already doing FP-SRH to understand PHE is to find a project nearby and understand it, visit it, and that seems to be the best way to interact and with technical staff and then be able to replicate that. There are a lot of resources, and PRB has put those together through a PHE toolkit that is available through the K4Health website. It has a lot of great information on how to, on projects and implementation. And I think that and an e-learning course that are available through that Population, Health, and Environment Toolkit are a great first step toward better understanding these programs and moving towards implementation.
I think we have time for one more question before we wrap up.
I want to, I'll go ahead and just take a last question, and it really talks about the community group engagement, and just a comment that it has worked really well with PHE and it has proven great results in Kenya. I had a pleasure of working with the HOPE LVB project that Caitlin mentioned in terms of community engagement, and we really did feel that this was one of the critical aspects of the HOPE LVB project, which was the local engagement, not just with community members, but with institutions at a community level. And it was really nice to see this come out as a high-impact practice because we weren't sure what the evidence was, other than we could see the change, and to see that others have documented that evidence and made it a high-impact practice sort of validates what we were seeing. And I think rather than look for a lot more evidence in your programs, I encourage you sometimes to just refer to other evidence that this works. You don't always have to measure it yourself and prove it to every single person. So thanks for that comment about the community engagement.
I want to say thank you to both of our speakers, Jason and Caitlin. For those of you who may have missed something during the course of the webinar, it has been recorded, and we will be posting to the PRB and PHE project websites in the next couple of weeks, and we'll also be sharing through the Africa PHE newsletter, so I would encourage everyone to sign up for that. And if you haven't done so already, I would say please use the next minute to download the 3 resources in the handouts pane. And with that, thank you everyone for joining, and I hope this was helpful or enlightening for all of you. Thank you.
Right.
Thank you.